Right over here. Go right here. Where do you want? Go right here. So, Cynthia, I think for those in the room that do know her, you probably know her because of her work largely in DC, demanding more price transparency across the healthcare continuum, right? But Cynthia, you actually have a very interesting background, very relevant for this audience. So give everybody a little bit of an overview of what you've done with your life.
Oh, goodness. Well, when I started my career, I was in technology, like Mark, but I worked with IBM, and I had defense, and I had healthcare as my sector. And so I was helping hospitals and insurance companies automate sending their financial billings to each other, right? Way back when, that's the early 80s. But I was selling mainframes as a 22-year-old in software. And in the software, in the tech sector, we know that any innovative product needs to be better, far superior, address a broader existing need, and do it faster, more reliably, and at a far lower cost. And that's because it's fully transparent. And you compete on quality and price. And the healthcare sector, however, is a bit different. Fast forward my career after business school, I went and started worked at Haemonetics in blood banking and medical device. And that's where I came out to start my first company, which was Viacord, to bank stem cells and treating cancers like leukemia, certain genetic disorders. And what we did is we applied the tech world model to healthcare. 1992, when we launched commercially in 96, we basically came out to provide the lowest possible price we could charge for all Americans and actually across the countries globally. The same price for everyone. What is the absolute lowest price to pay? And then be fully transparent about quality and outcomes. So we published in peer-reviewed journals every single transplant we did. We did the first sickle cell transplant. We did the first leukemia transplant in Miami-Dade. And so knowing that it can be done, because Mark and you're doing it, I did it, and we did it at 1/10 of the comprehensive cancer centers charging, and also 1/50th of what a bone marrow harvest would be. So net, I know it can be done, and so when I sold my company and when I had an opportunity come on how will I philanthropically take the skills and apply it, I basically saw a critical need that came because serendipitously 3 people came in my life 9 years ago that had absolutely crushed with financial ruin from our healthcare. 2 of them had cancer. One had breast cancer. I helped her file personal bankruptcy, and it was all because of $9,000 of drug costs. $9,000 put her to lose her home and personal bankruptcy, and I got her on Medicaid and moved her. And that is just a desperate situation. You can't even move out of state if you need Medicaid in your state and you're in cancer care. You have no freedom. You're locked in. And another was a nurse at Mass General who had cancer, and Mass General didn't cover it in her plan. Denial, right? Pre-auth, denied proton beam. They said that best modality, you're all in cancer specialty. And they said, well, we're going to delay your care. We're going to set you up with a social worker, and you need $38,000 for a GoFundMe. And then my handyman needing $6,000 for an out-of-network anesthesiologist. Well, the surprise billing balance billing was egregious. And I felt that was sort of the mission that came to me as like, oh, I know what to do. I'm going to go to Washington. So 9 years ago, I went to Washington, hired a bunch of lawyers, and we read the existing laws. Because I thought, how do I know proton beam is $38,000? And this is her own hospital, and I would think certainly they could give it to their own nursing staff at cost. But what is cost? And wait a minute, we're just messed up because we do not have a free market in healthcare, right? Now, how many of you personally or your family members have been overcharged by medical bills that you never thought you expected to pay? How many of you were successful at knowing what the true price should have been that you should have paid with your negotiated plan or cash?
John.
Okay? And did you successfully remedy it? God bless you. And how many of you know it's really hard work to get that information? Why? Because we have disinformation. Because the very people that need our health care is all of us, right? We are non-informed and ill-informed about the modality of cancer care or care of any kind, of what is the best of practice. We know it in our businesses. This is how we operate. What's the best practices? And then iteratively improve. And what is the most efficient way to deliver that modality? And at what lowest possible price to the individual, their family, the employer, the union, and all of us, as taxpayers and societally. And unless we have prices in healthcare, just kind of what's a big light bulb that went over my head, is unless we have prices in healthcare, then how do you usher in what everybody does in every other market? All of us know how to shop, okay? We want to know what we're going to get and what it's going to cost us. So we know if we see prices and have integrity to those prices, well, one thing, if we've been overcharged, like we all raised our hand, well, then we have a leg to stand on as a patient, because then we have financial certainty as to what is truth, what we should pay. And truth goes to what Mark said is trust. So the reality is the only way that we can have integrity and accountability in our healthcare system is to pull back the curtain and do exactly what Mark has done. And thank you, Mark, because it is so exciting with his background in tech, but also broadcasting, and your success and gravitas is truly transformative for price transparency and its effect to drastically lower the cost of care. So I commend you for your time, energy, and the impact you're making. And look, now I'm in Washington, full speed ahead, and Trump got price transparency in through the hospital and the insurance industry because we found it in existing law. We are all to know the prices in healthcare. Okay? We are, through decades, through a couple of big 800-pound gorilla laws, and they were being ignored by every administration to convert the law into rule of law. So in the first Trump administration, we were able to get hospitals and insurance companies to have to post all of their prices. But they're not clearly done, and they're not enforced by CMS to the level they can be. But all of us are the enforcers. Because, look, I'm sorry, I get all excited here, but we cannot compete as a country. Talk about a competitor, right? Yeah. But how do we compete against any other global country or enterprise if we're paying 2.5 times for healthcare for our American worker? Right? How do we compete as a country? I don't know about you, but I'm from rural central Pennsylvania, and I go to Main Street, PA, in my hometown, or I go in Ohio, and I go around, in Ohio. I'm going to tell you, unless we change this, and we can do it, because healthcare is like the second to third biggest expenditure for most business players. And I sit on public company boards, and I'm going to tell you, I just talked to 3,000 business owners that are ready to come with pitchforks because their insurance they're self-insured. Their coverage costs went up 20% this year, on average 23% last year. We're at 43% in 2 years. Okay? And they want to know, how do they pull back the curtain? How do they pull back the curtain? How do they get control of these costs? Because that's far higher than inflation. Mm-hmm. Right? We're like, if the coverage costs, because the perverted incentives are in the shadows and in the opacity, to charge as much as you possibly can, because the industry has not done what Mark Cuban's doing with disruption. The industry has lost its sights on the prize. The prize is what Mark gets, it's about the patient first. And it's all about his customer is the patient. And the industry has inverted and perverted itself that we are the product.
Mm-hmm. Amen. So obviously we talked about what Cost Plus Drugs has been doing on the generic side, right? We're talking about how we get into the brand sector as well, but we have pricing problems across healthcare, right? And a lot of what Cynthia has been working on is bringing that disruptive transparency into our broader healthcare delivery system. But there are a few hurdles in the way, and public policy is the elephant in the room, right? Mark, you were giving testimony in Congress yesterday. Cynthia, you're knocking on doors, investing tons of resources to try and change the dynamic there. What would you say is the policy that is a necessary catalyst to start reshaping all this for the better?
Well, I want to encourage all of you, because we don't need government to do it. Every one of you can do it. And you can do it by the policy you practice to take what Mark's done in this model, and what we're seeking to have is to pull back the curtain and figure out how you can make that patient first your customer. And that means the employer and the union plans that are helping to be the purchasers as well, because we are the true purchasers. Because think about it, you're in cancer care, okay? If all of you transformed the way you did business to basically eradicate all the many middle players in games and all the extra costs you spend at all these additional negotiations with the many, many players that now have been created, right? But instead, you just cut out all that administrative waste. You went and cut out the errors. And I know we all know that there's rampant fraud in the shadows, in the overcharges, right? Let's get at that. And from the models that, I listened to the testimony, Mark, and then Dr. Keith Smith yesterday, who started a surgical center of Oklahoma. And he didn't need government to give him the policy. He just went out and did it. And I did it with my Viacord business, right? I charged everybody the same price and the lowest possible price I could. It was, and then we were able to do the early transplants. But what Keith did is he said, I'm going to price all my costs for ACL repairs, hernias, every kind of surgery, and we're going to put them up and put them online. And he created the Free Market Medical Association and hundreds more surgical centers that were price transparent. And he said to me, Cynthia, we've only lowered our cost my whole time at doing this, now over 20 years. Why? Well, he said, we knew what screws we used. So we got down to 2 screws, great quality, negotiated volume discounts, and passed that on to our patients. Oh, and what else did we do? We found that our insurance costs went down for our malpractice. Well, why was that? Because we're totally transparent and we guaranteed the price. And even if we had comorbidity patients with higher complexity, we would have a charge for that, and we were truly transparent. And if we lost money, we still stood behind that price. And he said, what happened is the actuarial said, well, you're hiring the best radiologists. You're hiring the best PTs. You have to hire a solid anesthesiologist that when you're going to deliver this, you're going to make your profit at that lower price. So I know I can tell anybody to use their prices as a reference today that nobody should pay more than $6,000 for an ACL repair or a hip replacement. I think I've seen prices somewhere between $16,000 to $20,000 for a hip, but we've also seen bills with no complications at approaching $200,000 for a hip, right, to employer plans, right? So if you're a school district, boy, that's a savings of a teacher. More than a teacher's annual salary. And so net is we can do it without government and create free market models and drive down the costs. But it takes iteratively, collective, I think we have a great opportunity. But in the meantime, policy, I'm going to tell you, I think it's a buzz. I think it's a moment. Just look at yesterday's Wall Street Journal. Right? We're at $27,000 for the cost of the average family of 4. And most of those have a high deductible plan. So if they're a family of 4, that's $2,000 each, right? So that's another $8,000. So no, what are you up in the 30s, mid-30s for the cost of health care? And the New Jersey police testified in a Senate hearing before Mark's that their annual amount is $67,000 for coverage. New Jersey police. And 27 of that comes out of their hide, out of their paycheck. Okay? So I think we're at this point with policy that the price transparency effort, the train has left the station, and our government's shut down over the cost, right? And you all know, as well as we know, that the subsidies goes directly to the insurance industry for the Obamacare, right? That goes to the insurance industry. And that's a small percentage compared to the employer-paid self-insured 160 million lives. So the reality is that we can drastically compete on a global scale if we pull back the curtain, all of us get out the waste, the administrative waste, and become truly transparent. But I do think you are going to see policy by necessity come down the pike for radical price transparency, as the president calls it. And also we're going to start to see what's the fees, what are the spread pricings happening by all the intermediaries.
Yeah, I mean, I'm all for market solutions, obviously, but I agree with you. You're going to need some policy solutions. The most drastic, but I think most impactful, and I'll take a step back. When I talk to CFOs at hospitals, I've only ever talked to one hospital system who said they know their actual costs for a procedure. It's hard to know how to allocate the artwork in the foyer. How many, what do you add to the hip replacement for that? And so what I'd like to see, I don't think it would ever happen, what I'd like to see is if you're a nonprofit system provider, whatever it may be, you have to publish every single general ledger entry. Every single one. Because we're paying for it at some level when you don't pay taxes on what you earn. And you want to talk about transparency? Well, we can figure out, if you can't figure out what your costs are, if you give me access to your general ledger, I remember my accounting classes and my finance classes, I can tell you what your costs are.
I'll provide the beer.
There you go.
We'll look at it together.
Bring a 24-pack, right? But yeah, and so there's a lot of hospitals that don't want to know their costs. They just want to know if they can add another wing. And that is in direct conflict with trying to reduce the cost of care. There are hospitals that make money just doing Medicaid and Medicare. But they have to try to make money just doing Medicaid and Medicare. But you have CEOs in particular who don't want to run just a Medicaid or Medicare hospital because it doesn't pay as much. And I don't blame them, right? Everybody's got their own personal goals. But I think if you're not going to be transparent, if you're going to be subsidized by the taxpayers as a charitable entity, you got to share it all. You got to be naked. Like Warren Buffett says, when the water runs out, we'll see who's naked. We'll see which hospitals are being run correctly. And I think that's important to try to really get to true transparency.
So we had a couple of sessions. I heard a lot of consternation about what I would just loosely call the unpredictability of the executive branch of government, and so obviously we have Trump RX is out now, right? And look, when I first saw it and then saw the details, I kind of rolled my eyes a little bit. But what it is a pathway, right, and a philosophy that it's starting to try to address the problem of the disconnect between the real prices of drugs and the fake prices. And regardless of what it is today, what it represents is a philosophical endeavor to bring real cost to the actual consumer. So my question to you is, especially for a room of folks that are very interested in what might happen next, where do you see the Trump administration really trying to land when it comes to this broader philosophy of bringing radical price transparency to the market?
Well, I appreciate what you're saying too about the cost of drugs. Obviously the president doesn't like to get a bad deal, right? So I know most favored nations is a big part of it, but also getting the direct to consumer based upon Mark's model. It is the beginning, but even more so, the radical transparency applies to all of healthcare. Thank you. The radical transparency applies to all of healthcare. So drugs are really 15, 20% of the spend, and for generics and retail drugs. But when you look at specialty pharma and you look at medical, you're looking at 80% of what patients and employers and unions end up paying, right? And the taxpayers, right? So we have to pull back the curtain on all of this, and that is where I believe very firmly that the Trump administration is going, and is Congress. I mean, obviously, I think it's kind of funny because, Congress, Pharma did a lot of ads in Washington, if anybody who hasn't been there, against the PBMs. They did some really clever ads. But the reality is pharmacy benefit managers, as Mark said earlier, they're really owned by a majority of the insurance carriers, right? So it's really the insurance industry that has a lot of the big data on all of us as the product, right? And also has all of the vertical integration along with the hospitals. In fact, I've been in meetings where I've heard both in the industry call it, well, we're in co-opetition with each other.
Oh, yeah.
Right? Now, to the patient's perspective, I have to ask, if you're not pulling back the curtain on prices and quality and outcomes, because if I want to look at oncology, if any of us have somebody diagnosed in our family, the first thing we want to do is say, oh my gosh, who do we go see? How do we get access to care? And what's the best protocol? And how do we get access to the best care provider that's going to assure the most longevity and quality of life for our loved one, right? That's what comes first. So I would say that should come first to all of our businesses, is going back to Mark's model, is putting the patient first. And then as we look at the pricing, we have to look at pulling back the curtain on all of that, because let's look at business models that reward, like let's look at radiology and oncology, right? If you're doing iterative small doses and you're saying, okay, we can make more money at that, it's far more profitable. If we bring that patient in more times, less dose, we'll just tell them they will have less side effect. But maybe the 3 big blasts is better because they work full time and they have a family to take care of. And they don't have a day to take off to drive and be there and sit and wait, right? And maybe they can take that tolerance, and maybe it's at 1/8 of the cost of what it would be differently. But we have to look at that whole perspective to deliver the best of care and have it be, that information be totally realized to all of us. Because the only way we, like, look, let's take it into effect. We're dying earlier than any of our developed countries. We're dying 8 years earlier than Singapore and Japan. And they took our model from the 60s and 70s to deliver healthcare. We should be ashamed of that. We're the most innovative country in the world in this, in education and in delivery. So how can we tolerate that we want any of us or our loved ones to die 8 years earlier than we potentially could? And we're paying 2.5 times more. So I just think that, you know, the Trump administration and now Congress, I think we're at a tipping point. Read yesterday's editorial by the editorial, one of the authors said he's ready to come with a pitchfork to the healthcare industry because of the lack of transparency. And his mother-in-law, she went for a well visit, but got $200 in a facility fee and then evaluation and management. Look, I have reporters telling me, Cynthia, I can't tell my own story, but I cried when I got my diagnosis, and I got a $92 bill. I'm a reporter. I got a $92 bill for emotional support by my physician because they found a code to upcode me. And she says, I can't tell that story, but you can. So we can do better. And so rather than seeing us as a product at every turn, take this model. That is Mark's model, is the model for all of us. And I'm going to tell you, I go in the White House, Biden administration was tough because it was, you know, it was tough. Even though it was Obamacare used as law and Trump got it done, they didn't want to help Trump policy. So, but I finally had someone say to me, I finally get what you're advocating for. My dad had prostate cancer. He took 3 doses, and he had to pay $3,600 a month out of pocket for his prostate drug. And he sat my sister and me down and said, I'm not taking it anymore, and I want to die and leave you my legacy of my financial savings. I'm not doing it. And she went to Mark Cuban Cost Plus Drugs and saw that that cancer drug was $66 a month. And thanked me for this advocacy. Thank Mark Cuban, because now she has her father, perhaps much longer life, being treated appropriately and at an appropriate price.
Mark, you already... Mark, you already said yesterday Trump RX is the best thing that's ever been done.
In the history of things.
So
no one's ever. And by the way, we are going to work with Trump RX, and we're going to save you 1,000% on every drug.
You heard it here first.
I think that's beautiful. Big and beautiful.
I know we have just a minute left. I want to leave with just 30 seconds from both of you. You all have done so much. What's next? How are you going to best maximize value in your next endeavor in the healthcare disruption?
I mentioned Cost Plus Wellness, where we'll publish contracts. And I strongly encourage any of you who are providers to please reach out to me, mark@costplusdrugs.com. And I'll connect you with our folks that would love to do direct contracts with you. We're going to be pushing heavily into more branded drugs, specialty drugs. If you're a provider, check out business.costplusdrugs.com. We'll save you money. And if you're a manufacturer, please email me if you have any medications. We want to carry all FDA-approved medications. And now you know that we'll only mark it up 15%, which means you're going to get examples of patients like Cynthia mentioned with your medications. And isn't that what it's all about? So you're going to see us learning and growing and extending. And, and I give Trump RX a hard time, but, I'm not one of these people that say, well, because it came from Trump, I'm not going to do it. If you use the T word, it's wrong. I'll do anything that helps patients and saves them money. I don't care where it comes from, because that's the goal. So if you guys have any ideas on things we can do to do it better, send them along.
Cynthia?
Yeah, I'd like to emphasize that this is truly a bipartisan issue. And we've polled it every year, and it's at a 96% issue.
Yeah, you got Rick Scott and Elizabeth Warren at my hearing working together. It's like cats and dogs living in harmony,
Yeah, and Bernie Sanders wanting to codify the Trump rules. I mean, really, this is so bipartisan. But the reality is it's because it's for every single one of us. So where are we going to go? We're going to keep going, because the truth is in the numbers, right? The truth is in the numbers, and the truth is going to set us all free to be able to get the best care and the best possible outcomes at the best possible price. And we all want to compete and live longer and live healthier lives, right? And this is for all of us. And I would say that I'm following Mark's lead also, that we believe very firmly we need to pull back the curtain on the contracts. Mm-hmm. Because it's not just a derivative of prices. The contracts with outliers, carve-outs, exceptions, all of that, and the spread pricings and the fees are the true prices. They're the true prices. And we got to stop having our family members or us become whales for the industry to make hundreds of thousands or millions of dollars more than what would be an appropriate fair market price, right? And that's going to end up being the best outcome for all of us. But I think what we're going to continue to do is measure the success on price, quality, and outcome transparency. And we welcome all of you, because we will tout you, publish you, put up billboards thanking you for doing the right thing. And I think there's a better model here. And the only way we have value-based care is that the true purchaser clearly understands what the quality is, what survival or potential outcome that the individual could expect in your best practices, and at what fair market price. And listen, I do focus groups around the country. Every single one of the people in those rooms say they want everybody to be treated fairly. They may be grateful for what they have and that they could afford to purchase it, but they want our country, and we want everyone to have access at the best possible price and have the outcome to living a long, healthy life.
Thank you.